Many people struggle with sleeping. In fact, 50 to 70 million Americans have a sleep disorder. That's according to the National Institutes of Health. 7 News anchor Taylor Murray spoke to a doctor about sleepiness during the day, brought on by narcolepsy, and how to treat it in this week's Ask the Expert.
Narcolepsy is a condition characterized by extreme sleepiness during the day and falling asleep suddenly during the day. Dr. Ahmad Buddha, an expert in sleep medicine, says although those are the most common symptoms, it doesn't always mean you have narcolepsy. There are other things doctors look for when making a diagnosis.
The simplest way to understand it is basically emotionally triggered sudden weakness in your muscle, especially facial muscles, leg muscles, for example. And that's usually by laughing or telling a joke, that kind of stuff.
Someone with narcolepsy may also experience hallucination.
Like thinking there's things around you or you're hearing things not actually present.
Dr. Buddha says the exact cause of narcolepsy is unknown, but genetics or autoimmune diseases could play a role. If you are struggling with daytime sleepiness, doctors will first try to rule out sleep apnea. If it's not that, you may need to do a nap test.
Then the patient will need to stay in the sleep lab for the next day to do what we call it multiple sleep latency test.
Every 2 hours, the patient is given an opportunity to sleep for 20 minutes or more. Doctors are looking at how quickly they fall asleep.
If the patient have tendency to fall asleep rather quickly, with the average sleep latency 8 minutes or less, and they develop what we call like REM sleep, they actually have REM sleep during the nap, then that make it very highly suggestive narcolepsy.
Narcolepsy is most often treated with medication.
Once we confirm the diagnosis of narcolepsy, there are two different things we need to do to improve and treat the narcolepsy. Number one, we need to improve the nighttime sleep. A lot of narcoleptic patients have a lot of sleep disruption and fragmentation of their sleep. So that means you may again need to some sort of sleep aid or medication to help with that.
Dr. Buddha says the second thing doctors will do to treat narcolepsy is to prescribe a stimulant to treat daytime sleepiness. Taylor Murray, 7 News.
To submit a health topic for our Ask the Expert series, head to our website, click the News tab, then click Ask the Expert.